Welcome back to Parasitology. Hi, I'm Christopher. We have reached the final video in our short protist review series, and it's time to visit the weird shelf. These organisms do not share one tidy life cycle pattern, host, or body system. Instead, we will sort them by three practical clues: host, system, and environment. Today that means pigs, rabbits, fish, birds, and a few aquatic or exotic outliers. Taxonomy brought the clutter, but we're bringing the labels. Here's the whole lesson in map form. A pig with a large intestinal ciliate points towards Balantidium coli. A rabbit with neurologic, renal, or ocular disease should place Encephalitozoon cuniculi on the list. White spot disease divides by water. Freshwater suggests Ichthophthirius multifilis, while marine systems suggest Cryptocaron irritans. For fish, reptiles, and amphibians and other exotic species with a gastrointestinal flagellate form, recognize Hexamita or Spironucleus. Blood parasites such as Plasmodium and Protoist plus amoeba stay on the lighter recognition shelf. The recurring rule is simple: match the host, the affected system, and the environment before reaching for a name. Balantidium coli is the classic pig-associated intestinal ciliate. Some newer sources use the name Balantidium coli, so just know you may encounter both. The species name coli points us towards the colon, which is exactly where this organism belongs, the cecum and large intestine. Pigs are often subclinical, but infection may be associated with diarrhea or colitis. The public health concern comes from its zoonotic potential, especially where sanitation is poor. Transmission is fecal-oral through the ingestion of cysts in contaminated food or water. On microscopy, the large motile ciliated trophozoite is difficult to forget. It looks less like a subtle protozoan and more like a microscopic shag carpet with somewhere to be. When you think of pig, large intestinal ciliate, fecal-oral route, and zoonosis, think Balantidium coli. Encephalitozoon cuniculi is a spore-forming intracellular microsporidian associated most strongly with rabbits. The name is useful. Encephalo points to the brain. Zoon means animal, and cuniculi refers to the rabbit. Microsporidia are literally small spores, but their clinical effects can be anything but small. Think in three target systems: nervous system, kidneys, and eyes. Clinical clues include head tilt, ataxia or vestibular disease, nephritis, and ocular disease like uveitis or lens-associated lesions. Some infected rabbits remain subclinical. Spores may be transmitted through urine contamination and ingestion, and vertical transmission can occur. Diagnosis requires context. Serology supports exposure, but a positive antibody result does not itself prove active clinical disease. PCR, histopathology, and tissue lesions may add support, but interpretation still depends on clinical pattern and the species in front of you. One positive antibody test is evidence, but not a tiny rabbit courtroom verdict. Remember, rabbit plus neurologic, renal, or ocular cues equals Hepatozoon cuniculi. Two ciliates can produce the same memorable presentation: white spots on the skin and gills, respiratory distress, and gill damage. The sorting clue is not the polka dot costume, it is the water. In freshwater fish, think Ichthophthirius multifilis, commonly shortened to ich. The prefix ichthyo means fish, which is a lot easier to remember than the full name. On microscopy, the large trophont classically has a C-shaped or horseshoe-shaped macronucleus. In marine or saltwater fish, think Cryptocaron irritans. Crypto means hidden, carrion refers to the nucleus, and irritans is refreshingly honest about what it does. Cryptocaron lacks the characteristic C-shaped macronucleus of Ichthophthirius. Both have direct life cycles within their aquatic systems, so crowded tanks and environmental contamination help outbreaks build momentum. Freshwater white spot equals Ichthophthirius. Marine white spot equals Cryptocaron. Same white dot wardrobe, different address. Hexamita and Spironucleus are diplomonid flagellates, used here as aquatic and exotic context organisms. The trophozoites have a bilaterally organized body plan with 2 nuclei. They are associated with fish, reptiles, amphibians, and other exotic species, most often in gastrointestinal discussions. The clinical pattern is nonspecific: diarrhea or loose feces, malabsorption, poor growth, weight loss, wasting, chronic enteritis, and poor body condition. Transmission is generally fecal-oral, with contaminated water, crowding, poor husbandry, and environmental stress shaping the case. In reptiles, Hexamita may also appear as urinary tract infections, particularly in chelonians. Diagnosis relies on fresh fecal or intestinal samples, microscopy, and the case context. Recognize the pattern, but do not force every flagellate into Giardia's lifestyle wardrobe. This is a recognition shelf, not a deep dive. Plasmodium species fit the avian malaria pattern and are transmitted by mosquitoes. Hemoproteus species are related avian blood protozoa transmitted by biting midges. Leukocytozoon completes the pattern and is usually transmitted by black flies. Its gametocytes may markedly distort the infected blood cell on a smear. The vector is a useful sorting hat, not a diagnosis. Mosquito suggests Plasmodium, biting midge supports Hemoproteus, and black fly supports Leukocytozoon. The bird, blood smear appearance, geography, and vector context all organize the differential. Amoeba remain separate protozoans. Intestinal or free-living amoeba may appear in a broader parasitology and public health discussions, but the goal here is category recognition, not an amoeba encyclopedia. Recognize the names, place them in the correct neighborhood, and keep moving. Let's finish with 6 tidy patterns from a deliberately weird shelf. Pigs plus large intestinal ciliate, Balantidium coli. Rabbit plus neurologic, renal, or ocular disease, Encephalitozoon cuniculi. Freshwater fish plus white spot, Ichthophthirius multifilis. Marine fish with white spot, Cryptocaron irritans. Aquatic or exotic host plus a gastrointestinal flagellate pattern, Hexamita or Spironucleus. Bird plus blood parasite in vector context, Plasmodium, Leukocytozoon, or Hematoproteus. Amoeba remain on their own weird shelf. When the taxonomy feels untidy, return to the clinical map. Host, system, and environment. Weird shelf, tidy patterns. Thanks for watching. I'm Christopher Lee, and what you know today protects everyone tomorrow.